In this video, we're going to talk about coronary artery disease. This can be found in your TIMBY book in chapter 25. The coronary arteries supply blood and oxygen to the myocardium. Remember, myo is that middle layer. When they are blocked or narrowed, ischemia and injury can occur to the muscle. An MI can occur, causing death to the muscle supplied by the blocked coronary artery. CAD, or coronary artery disease, is a leading cause of death in the United States. This is usually caused by atherosclerosis, which is a form of arterial sclerosis. Atherosclerosis occurs when fatty substances are deposited into the wall of blood vessels, making the lumen narrow. It makes them less elastic, which also means that there's less blood supply coming through. Arterial sclerosis is the hardening of the arteries. Same thing, hardening of the arteries, there's less blood flow coming through. It is theorized that an initial injury to the artery makes it vulnerable to the plaque formation, damage, or injury. This can occur from smoking, diabetes, or hypertension. The narrowed vessels decrease oxygen supply and can cause ischemia and possible tissue death. Here is just an image for you to look at and what we're talking about, those coronary arteries and what that plaque buildup looks like. Here is another image you can look at the different ways that it clots off those arteries. Here is a video I suggest you watch. You can click, if you open up your PowerPoint, you can click on this link and it'll open it up for you. Two major disorders associated with CAD are angina and the myocardial infarction. We will talk about each of these separately. Let's look at some risk factors. We're going to look at non-modifiable versus modifiable. Remember, non-modifiable are things we can't change. Heredity. We cannot change our age. Any greater than 40, they're at increased risk. Gender, males are more at risk. Females are at increased risk if they are on oral contraceptives. And after menopause can also increase the women's risk. Race, it is more commonly seen in African Americans. Location and social areas, that's North America, Australia, urban areas, poor social-economic groups. Now let's transition to modifiable risk factors. Smoking. If you quit, you lose your increased risk in 24 months. So you have to stop smoking, and in that 24 months you lose that increase. Your diet. We want to lower our cholesterol levels. Non-compliance. This is talking about our medication. We also want to reduce stress and exercise. Remember, going back to our diet and lowering those cholesterol levels. Remember, we want our HDL to be above 60 and our LDL to be less than 100. Talk about some treatment. Obviously, prevention is the main goal. Fatty streaks that begin plaque buildup can disappear if the patient reduces fat and cholesterol intake. However, when they get to the plaque will not disappear. What do you think? What type of diet do we need to encourage as nurses? We're going to encourage a low fat, low cholesterol, limit our caffeine, and lower our sodium. We also want to have them limit their red meat. We want to manage their cholesterol levels. We want to have daily aerobic exercise. This can be running, walking. Of course, we always want to encourage them to stop smoking. manage your primary diseases. We're talking about going back to that hypertension and diabetes. They can take anticoagulants to help blood easily pass through those blocked areas. They can also take antiplatelets to prevent blood from clumping up. Some surgical interventions. First, we're going to talk about an angioplasty. This is a balloon that is floated into partial occluded artery by a cardiac catheterization method, and the balloon is open to push the plaque back against the vessel wall. You can see there in those pictures A, B, and C how it opens up that artery a little more. Another surgical intervention is a stent placement. This is a coil spring tube that is inserted into the occluded artery to force the lumen to stay open. There's an increased risk of bleeding and valve problems due to the movement of the stent. Here are some videos that I have found that talks about angioplasty and kind of shows you what exactly is going on. Another surgical intervention is arthrectomy. This is the same insertion method as a cardiac catheterization, but the plaques are shaved down and excreted by the kidneys. So when we're talking about this, we need to make sure that the patient kidneys are working appropriately. Another surgical intervention is a coronary artery bypass graft, which uses blood vessels from another part of the body and connects them to blood vessels above and below the narrowed artery, which is bypassing that narrowed or blocked artery. So the coronary artery bypass graft. So we're bypassing that narrowed or blocked artery. Another surgical intervention is a transmyocardial revascularization. This is for severe CAD when they are not a candidate for that coronary artery bypass graft. This is when a high energy laser creates new channels for blood flow by zapping that area. So what's happening here is this makes tiny holes in the left ventricle, which sends blood to the heart muscle. Now we're going to transition and look at angina. Angina occurs due to a low blood flow and lack of oxygen to the heart. So remember, the blood vessels provide blood and oxygen to the heart. Angina occurs when the arteries become lined with plaque. The blood flow through the coronary arteries narrows until ischemia of the myocardium occurs. The myocardial cells become ischemic within 10 seconds of the coronary artery occlusion. After several minutes of ischemia of the heart's ability to pump is reduced. A transient pain known as angina occurs due to the lack of oxygen and usually lasts 3 to 5 minutes until that blood flow is restored. So what are some characteristics of angina? Let's first talk about that sensation. They could have gas or heartburn feeling. They could have a squeezing, heaviness, or burning. They're going to describe the severity as mild to severe. The location is going to be substernal. They could have some radiation to the left arm, shoulder, or jaw. The duration is it's short, usually less than 5 minutes. Usually this can be relieved by nitro. Some other symptoms that may occur are dyspnea, pallor, sweating, faintness, palpitations, some digestive disturbances. You can also have tachycardia, possible dysrhythmias, and nausea and vomiting. The diagnostic test that they're going to look at, they're looking at diagnostic tests to rule out a myocardial infarction. So pharmacology, what exactly can we do? We're going to start with vasodilators. This is the first line of choice for an acute angina. The most common of those would be that nitroglycerin, which is the medication of choice. Other medications used could be calcium channel blockers, beta blockers, or opiates. A way to remember another diagnosis or treatments would be remembering MONA, M-O-N-A, which stands for morphine, oxygen, nitro, and aspirin. Those are going to be the four things when you have a patient coming in with angina: morphine, oxygen, nitro, and aspirin. Nursing care. We're going to determine how long they have had angina, what is their risk for coronary artery disease, and their anxiety level. We also want to assist pain and give nitroglycerin as ordered. We want to notify the doctor if the pain is not relieved after 2 doses of nitroglycerin. We want to encourage them to rest, avoid stressors and triggers, encourage compliance with a low-fat, low-cholesterol diet. With angina, our goal is to decrease your oxygen demand while increasing your oxygen delivery.